caused by pathogens that pass from one person to another. Another class of diseases stems from entirely different sources. These diseases may be due to heredity, lifestyle, or some combination of the two. Chronic diseases are diseases that are not transmitted by pathogens and are present either continuously or for a long time. Degenerative diseases are chronic diseases that cause continued breakdown of body cells, tissues, and organs. Some chronic or non-communicable diseases are due to heredity. Defects in the genes of parents cause the disease, and they can be passed from one generation to another. Not every child, however, will inherit the faulty gene. Other chronic diseases develop as a result of lifestyle choices, such as smoking, using illegal drugs, following an unbalanced diet, and not getting enough exercises. Environmental factors are also involved. Cardiovascular diseases, or diseases of the heart and blood system, are among the most common non-communicable diseases in the United States. In fact, cardiovascular diseases are the leading cause of death among Americans. These diseases could be less of a threat if more people took steps to prevent them. Some well-known cardiovascular diseases. Arrhythmia is an abnormal or irregular heartbeat. Arrhythmias can be a symptom of serious heart problems, but often they are of little concern. The heart may beat very slowly or very quickly for no apparent reason. Heart attack is a condition that results when the blood supply to the heart is blocked off or interrupted. It can result in disability or death. Arteriosclerosis is a general term used to describe several conditions that cause hardening and thickening of the arteries. Stroke is a condition caused by a blocked or broken blood vessel in the brain. A stroke can result in paralysis or death. So the difference between heart attack and stroke: heart attack has a blocked supply of blood to the heart, and stroke is a blocked supply of blood to the brain. Hypertension is high blood pressure. It occurs when the pressure that blood exerts on the artery walls as the heart beats is above normal for a long period of time. Angina pectoris is chest pain that results from narrowed blood vessels in the heart. If the blockage is severe enough, a heart attack can occur. More than 1 million Americans have heart attacks each year. More than 40% of them die before reaching the hospital. During a heart attack, a completely blocked artery prevents oxygen-rich blood from reaching a section of the heart muscle. This part of the heart muscle dies and cannot be repaired. Other forms of cardiovascular disease can also increase the risk of heart attack. For example, fatty buildups and blood clots can block arteries in the heart. Hypertension can also place a person at risk for a heart attack. As tiny arteries tighten, the heart has to work harder to pump blood through the narrow spaces. A heart attack or a stroke can result. Regular blood pressure readings can detect hypertension, enabling physicians to treat it. A blood pressure reading involves two numbers. Systolic pressure is the force of the blood flow through an artery when the heart beats. Diastolic pressure is the force exerted when the heart rests between beats. A normal reading for his systolic pressure is lower than 120. Readings from 120 up to 140 indicate pre-hypertension. Readings above 140 indicate hypertension. For diastolic readings, a reading is below 80 is normal. A reading of 80 to 90 indicates prehypertension. Readings above 90 indicate hypertension. So a normal reading should be around 120 over 80. What personal and environmental factors place someone at risk for cardiovascular disease, and what can be done about them? You can control your own behavior, but other risks are beyond your control. Being aware of them and keeping personal health record, however, can help. Family history. If your blood relatives are African American, your risk of having high blood pressure is 45% greater than that of Caucasians. If a parent, brother, or sister had premature heart attack, your risks are even greater. A premature heart attack is one that occurs before age 55 for males and before 65 for females. Age and gender risks. The risk of heart disease increases with age. Males under the age of 40 are at higher risk than females in the same age group. After age 65, however, heart disease is the number one cause of death among females. Tobacco use. As early as 1964, the U.S. Surgeon General stated that cigarette smoking was the greatest risk factor in the development of cardiovascular diseases. In fact, smokers run a 70% higher risk than non-smokers of developing cardiovascular diseases. Nicotine uses the heart to pump faster than it should and increases resting blood pressure. Nicotine and other substances in smoke cause increased heart rate. Carbon monoxide in smoke takes the place of oxygen in the bloodstream, denying the heart adequate oxygen. Stress. Stress causes the heart to pump faster than it should. It increases resting blood pressure. Stress may make a person feel tired, but at the same time interfere with the ability to sleep well. Distribution of body weight. People who carry most of their weight around their waist area are at increased risk of heart disease. These people are called more apple-shaped. People who carry most of their weight in their hip area have a lower risk, and they are called a pear-shaped. Diets high in saturated fat and cholesterol increase the risk of atherosclerosis. Foods containing antioxidants, by contrast, may lower the risk of heart disease. Antioxidants such as vitamin C and E are substances that protect cells from being harmed by oxidation. Weight and physical activity. The heart of an overweight person must work harder to pump blood than that of a fit person. Proper diet and exercise lower the percentage of body fat, help clear fat from the bloodstream, and lower blood pressure. Aerobic exercise especially reduces the risk of heart disease. Regular medical checkups. Many people have hypertension and do not know it. A physician can detect it during a regular checkup and prescribe a diet and drugs to combat it. If necessary, the physician may order an electrocardiogram. An electrocardiogram, or EKG, is a measure of the electrical activity of the heart. A number of drugs can lower blood pressure and control arrhythmia. Balloon angioplasty, another treatment option, is a procedure in which a balloon-tipped tube is introduced into a diseased blood vessel. As the balloon is inflated, the vessel opens further, allowing for improved blood flow. A device called a stent also may be inserted into a diseased blood vessel to improve blood flow. A more extreme form of treatment is surgery. The implantation of pacemakers is a common treatment for heart disease. A pacemaker is a small mechanical device that sends steady electrical impulses to the heart to help it beat regularly. Physicians also may perform surgery on heart valves. A surgeon can remove diseased valve tissue and replace it with a human-made or animal graft if needed. Bypass surgery is surgery that fashions a detour around a narrow or damaged artery or vein to allow blood to reach the heart. During bypass surgery, the surgeon opens the patient's chest and separates the breastbone so the heart and aorta are visible. In most cases, the surgeon then removes a vein from the patient's leg and grafts it onto the clogged heart arteries. The new blood vessel routes blood around the clogged areas.